I'm a wife, a mum, a grandma to 3. I have elderly parents and my life is completely mad. Recognise it? But it's always missed off on the CV because it just sounds like, oh yeah, you did this, you did that. But actually it doesn't really tell you about the person, does it? So I have so much more than all of those things that turn up on my CV. Thank you so much for inviting me today, and it's great to see people in person, but also those of you online, hello. I'm going to apologise for people online in particular who are not in this country. I'm going to be talking about the NHS and the 10-year plan, and mainly England, but there are lots of messages for midwifery within that, so I hope it is appropriate for all of you. I just have one message for you all today, and I want you to go out of here feeling empowered to have a collective voice for change. That's all you need to do, because that is becoming even more important as we look at the landscape, the complex landscape that we're all working in. And I know with just the recent change in government and the work that's been going on towards the NHS 10-year plan, that it's even more important for us to have a collective voice to represent women, maternity and neonatal services. Neonatal services have very little voice. Maternity and neonatal services and midwifery. And unless we can all come together to have a collected voice with a clear message, our voices and our message is diluted, and potentially that's what governments want. So I knew that this was going to be a key moment in our history of midwifery and maternity and neonatal care when I was invited to the first Lord Darcy review meeting. Women weren't even mentioned. I was on the table, would you believe, for emergency care. For some reason, they thought that was the appropriate place to put the midwife, the only midwife in the room. So I can say that I was truly disappointed. I had a word with him, I was invited to the second session, and maternity and women did get a small mention in the review report, you may have noticed, but it was so small, it felt unimportant to me. So we absolutely have a big task on our hands. Now, we put together for the RCM, which represents more than 90% of midwives in the UK and wider, we put in a submission that I thought would really try and, give a clear message about what was important and try and turn that around. But what I realised is that we all have to have that collective voice. What we have said throughout our evidence gathering and our events and our stakeholder submissions, the most important thing is getting the workforce right. You can't have all those other aspirations without the right workforce that underpins safe and good quality care for women and families. Do you all agree that if we don't get the workforce right, it will never, ever change? And to be honest, the system has let us down for decades. The numbers are wrong. The skill mix is wrong. The bursary went. The culture's wrong, but we can do something about that. The resources for equipment and hospitals and environment and community settings are all wrong. But I'm going to start with good news, because actually, my cup is always half full. And the good news is that for years of lobbying and collective lobbying, the number of full-time equivalent midwives is rising. Now, you may not feel it, because the care you're giving women is getting more complex. But there's been a huge investment in student places, and they have risen and the numbers have risen from 21,000 in 2014, so it's in 10 years, to 24,000. That's 3,000 extra midwives, so we can celebrate that. And we know that maternity care and outcomes are definitely on the desk of the health secretary, and he says it keeps him awake at night. Well, it's not keeping him awake every night because it's really hard to meet him, although we have, and we've got another one coming up, but I think he needs a few more sleepless nights, to be honest. The 10-year plan, and have you seen the 10-year plan? Have you seen, you won't have read the whole thing, but you've seen some of the things in it. There were 3 key shifts that are mentioned in the 10-year plan, and we're all now giving more evidence about what that means for each part of the NHS. Number 1 is moving care from hospitals to community. Have you heard this before? Honestly, it's like reinventing the wheel. Who watches Call the Midwife? I'm sure you all do. You know, there we're seeing 1970, they're moving care from the community to the hospital. We've been trying to move it back for years. But actually there's a huge opportunity for us here because it's not moving it back in the way that it was. It's how do we build the team around the family in the community so that women absolutely have a voice and an access to the care they need and want. So what does that new shift look like for maternity and neonatal care? And there's some really good ideas out there about what that means. Number 2, making better use of technology in healthcare. Well, don't we all want that? You know, AI is going to become a key part of risk assessment and the work that we do as midwives. I hope we don't have AI guiding how we birth a baby, but hey. But I know that there's maternity services out there that still don't have a fully functioning maternity information system. So there's a long way to go, but there's some huge possibility there. And then finally, this is a gift to us, focusing on preventing sickness, not just treating it. Now, you know as well as I do, the intervention called a midwife improves the health and the health outcomes of not just the mother but her family because of that empowering experience, hopefully, that women have. So preventing sickness and not just treating it for mothers, babies and families is absolutely a gift for us. So how can the 10-year plan support positive change? And we've called for 3 clear things and lots of words around it. Number 1, as I said, workforce, the right staff in the right place with the right education and skills. We can't expect anything less than that. But actually, that takes a lot of work, and there's a lot of thinking that we need to do around making sure that's right. A cultural shift of learning to listen. Now, you will know, like I do, all the inquiries and all the reports about maternity care says that the staff are just too busy or unable to listen. You don't intend not to listen, do you? But actually, so many things going on. It's so difficult to listen. But learning to listen and learning to listen with impact. What are you going to do differently for the woman that you're caring for, but also the service that is being provided? And we have to learn to listen to reduce the huge amount of inequalities within our system. And we know what those inequalities are. It's the data that we have that is really good. We know that inequalities exist, and we have to make a focused effort to do something about that. We also have to really recognise and look at that investment on the maternity expertise in prevention and that huge topic of public health. What an opportunity, that first contact women have with maternity services to really impact on her health. And we do that as midwives and the midwifery community. So what does this mean in practice? Well, we keep knitting midwives, and they keep leaving. Okay. Amanda, were you knitting midwives this morning? I can't see her, but we need to knit more midwives, definitely. But retention of existing staff is absolutely a key part of that. Because if you don't love your job, you're not going to stay. So what is it that's going to make a difference to you to make sure you love your job? Most of the time, it's the team you work in. You know when you have a good day with a good team, and you know when you have a bad day with a bad team. That makes a massive difference, doesn't it, to you and how you feel about your work. But we know that midwives tell us, and MSWs tell us, that they want options for better career progression. There are lots of opportunities in our profession to develop and move into something different. But how is that supported, and how do you feel about that career progression in the place that you work in? We know that we have to change this tide of the negativity around midwifery. Do you speak to everybody with passion and positivity about being a midwife? Or do you do a lot of moaning? Because the person you're talking to, the person that's hearing you, might be a potential midwife in the future. I picked my grandchildren up from school on a Friday, And I was talking to a young mum there, and she said, oh, I hear you're a midwife. I said, yeah, it's great. I said, what about you? She goes, oh, do you know, I always wanted to be a midwife, but everybody puts me off. Do you know, I felt so sad. So I spent the next 20 minutes talking to her about how brilliant it was being a midwife, and I might have got her. I'm going to catch her again next Friday. Anyway, I absolutely know that this is on our shoulders, every single one of you in this room, to talk positively about the good things about midwifery 80% of the time. Because we have to attract the future generation of midwives, and it is on our shoulders to do so. We have to improve the workplace culture, be kinder to each other. You know, one of the things I hear often from people who aren't midwives is, why is your profession at war with each other? It's got to stop. We can have differences of opinions, absolutely, but let's all be on the same page, be kind and supportive of each other, and create a midwifery community that other people recognise. Doctors do it really well. We have to expand things like the fully resourced degree apprenticeships, and there's good successes there, and we have to protect time for learning to enable and empower staff to provide good quality and safe care. And that has to happen. So retention of staff I've mentioned already, and I know that people stay when there's enough staff. Now, it doesn't have to be enough staff of the same profession, and there's so many success stories about really good skill mix and expanding the role of maternity support worker. I realise there's some maternity support workers here. Their role is essential in providing safe care with midwives and the wider team to women and families. We know that people want more flexible working. Again, there's fantastic examples. Greenwich and Lewisham, anybody from Greenwich and Lewisham here? The Any Shift campaign, where anybody could work any shift, it really improved their staffing. More than 50% of midwives work part-time and have caring responsibilities. How do you manage all of that working full-time and on shifts? But it is possible to split 24 hours and 7 days a week into a different pattern. So it is absolutely possible. Of course, everybody wants more pay. We've got a massive pay gap, and we keep fighting for more pay. But we have been in a period of austerity for as long as I can remember. At least we got 5.5% this year. We need to improve staff wellbeing to reduce risk of burnout. That's what we hear all the time. And some of that is about the complexity of the women you look after, including the culture you work in. And I've already said it's important to have opportunities for career development. Students and early career midwives, we need more collaboration between health and higher education because we need better workforce planning. There are students who've been trained that can't get jobs in their local areas. Well, that's mad. So where was the workforce planning when that was being done? We need more midwives. We need to employ the students as they come out of their education. What are we going to do about that? We need to really invest in midwifery education. We did a State of Midwifery Education report year before last. I'm not going to go, it's sad. We can't have a good and confident future workforce unless we get midwifery education right. So let's get behind that. We're looking at debt forgiveness for those working with the NHS, so that if you're doing your education, there must be a way that we can keep people in the NHS and provide the incentive to do that. You shouldn't be coming out of your education and training with 40,000 more worth of debt. It is unacceptable. And Wes Streeting's definitely heard that several times. And we need stronger support for clinical placements. We've got to keep students. They've got to have a really good experience so they want to be midwives and they stay in midwifery. But we all have a responsibility for that. And we need to expand the preceptorship programs because once midwives are qualified, we know it takes 5 years. That's what you tell us, 5 years to feel confident and competent as a midwife. That's a very long time. And usually, you know, within the first year, expecting people just to get on with it. You know, 5 years it takes. This is the biggie, improving workplace cultures. Our culture's not good. It really is not good. So we need to learn to listen and listen to learn from each other and from the women in our care. Staff absolutely should be raising concerns when things aren't right, and they should be supported to do that in a positive way. Because unless you're saying, do you know, I can't provide safe care to women, and that there is a collective solution to that, how can we ever make it better? We need to break down the barriers between all the professionals, and that can happen through multidisciplinary training. We have a group called Progress in Partnership, which is all of the professional associations and royal colleges in maternity and neonatal care. It's taken 2 years for us to really sit down round the table and listen and trust each other. So how are you going to do that in your services? How are you really going to create that equal, trusting relationship with women very firmly at the centre of care? I've put on here, abuse towards NHS staff must not be normalised. I hear so much, and it's a lot online. There's so many people who are abused online because of their difference of opinion, their ethnicity, whatever it is, and we do it to each other. That has got to stop, and we've got to make a collective effort to make sure that we call it out. And racism and all forms of discrimination absolutely must be challenged all of the time. Recognise it, understand it, lean into it, and do something about it. Everybody has a responsibility to do that. I've put in here about protected time to learn, because it's really important that if we're going to give women, help women understand evidence so they can make choices that are right for them, we have to have protected time to learn, because we have to understand that evidence in the way that women understand. And part of that is an opportunity for everybody within the multidisciplinary team to understand the same evidence. So there's no surprise when women are saying, this is what I want, and this is the evidence I know, this is the risk and the benefit of my choices. Everybody should know that. And we know that a lot of training, so mandatory training, is done in your own time. Again, absolutely has to stop. So what I'm talking about is our collective voices to create positive change. We have to embed that ethos by working in partnership across trusts and boards and the whole NHS. We have to learn from each other about what works, supporting everybody else to do the same. Competition has gone. We have to learn what works and talk about what works rather than what doesn't and what's wrong. And we really need to make sure that we use our very loud voices in our midwifery community to narrow that inequality gap that we know of, where we can really improve outcomes for women and families. Obviously, I'm here to talk much wider about the 10-year plan, but we have just launched a new strategy in the RCM, and it's absolutely at the right time in terms of influencing the 10-year plan. Because one of the things that we really want to do is to absolutely create a midwifery community with a much, much louder and consistent and focused voice. Otherwise, we will never, ever be able to influence in the way we want to, for women, for maternity services, for maternity and neonatal care, and for midwifery. Midwifery being the intervention that makes the massive difference, and that every woman must have a midwife in order for that to happen. So our new strategy is really, really simple. It starts with you. What are we going to do to improve your working life? What are we going to do to help you amplify your own voices, and what do we do to amplify voices on your behalf? But most importantly, how do we build a midwifery community that is not divisive, that is really clear about the core messages, and that comes together to influence in a way that absolutely is going to turn this tide and make a difference for the future of the profession and for the care of women and babies and families. Thank you.